So I'll be presenting about the innovation, Uberisation of eye care, and Dr. Swati Upadhyaya.
Can you speak a little louder, please, Swati?
Yes, sir. We have no financial interests.
The COVID-19 pandemic has become a major barrier in delivering effective eye care. Travel restrictions, economic considerations, and fear of contracting the virus have greatly affected patients' access to proper eye care. A delay in ophthalmic care, especially in posterior segment diseases such as glaucoma, diabetic retinopathy, and macular degenerative diseases, may lead to irreversible blindness and compromised quality of life in these individuals. Many of these diseases disproportionately affect the elderly, a vulnerable population that often needs caregivers and aides to assist them in their medical care. These added barriers, especially during a pandemic, have made visit compliance an important consideration for improving visual outcomes. Even though telemedicine has increased significantly to circumvent in-person evaluation, ophthalmology traditionally has been slow to adopt telehealth since the eye examination is often necessary to provide proper care. Fortunately, standard ophthalmic equipment has become increasingly more compact and affordable. These strides, coupled with wireless internet, have revolutionized the way we can approach delivering eye care. With compact, portable, and validated devices, we came up with the concept of Uberizing eye care, taking the eye care services to the patient's doorstep. Using our electronic medical records, we categorize patients as high risk and low risk. High-risk patients who miss the scheduled follow-up are contacted via phone and offered a home visit. The appointment is booked and a trained COVID-vaccinated technician with adequately equipped PPE visits the patient's home.
வழக்கமா 6 மாசத்துக்கு ஒரு தடவை அரவிந்த் ஐ ஹாஸ்பிட்டல்ல வந்து செக் பண்ணிட்டு இருப்பேன். ஆனா கொரோனா பயத்தினால நானும் மனைவியும் போக முடியல. அழைப்புல வந்து இந்த மாதிரி வீட்டுக்கே வந்து நாங்க வந்து டெஸ்ட் பண்றோம் அப்படின்னு சொன்னாங்க. ரொம்ப மகிழ்ச்சியா இருந்தது.
The patient is briefed about the different eye tests that will be performed. First, visual acuity is tested with a peak chart, a smartphone-based application. The intraocular pressure is measured with a handheld rebound tonometer. Visual field testing is done with a portable virtual reality-based perimeter. The C3 field analyzer has shown good correlation with the standard HFA testing. The technician can monitor the patient's visual field performance using a tablet. Once the test is done, the device can be safely sanitized using UV light. Finally, a fundus photo is taken using a handheld, non-mydriatic fundus camera. All the findings are shared with the physician at the base hospital, and a teleconsultation is complete. The patient is counseled about their eye medications, or if an urgent in-person evaluation is required. The entire process takes about 1 hour. The technician gathers all the devices and heads to the next appointment.
எப்பவுமே எங்க பசங்க வந்து உங்க ஹாஸ்பிட்டலுக்கு எங்களை அழைச்சிட்டு போய் கண்ணெல்லாம் செக் பண்ணி திருப்பி கொண்டு வந்து விடுவாங்க. இந்த கொரோனா காலத்துல அவங்களால அழைச்சிட்டு போக முடியாததால நீங்களே எங்க வீடுகளுக்கு நேரா வந்து எங்களுக்கு செக் பண்ணி ஆலோசனை எல்லாம் வழங்கினதுக்கு எங்களுக்கு ரொம்ப மிக்க நன்றிங்க.
The concept of Uberizing eye care is under a pilot program in our institution. We evaluated the expenses incurred and calculated the approximate charges for the patient. This amounts to around 1,500 rupees, which is about 20 to 25 US dollars. When done for 6 patients a day, 20 days a month, the total revenue is about 180,000 rupees per month, or 2,500 US dollars, proving it to be a financially sustainable model. Beyond the pandemic, the model of Uberizing eye care provides benefits both for the patients and for creating new job opportunities for young ophthalmic technicians. From our pilot experience, we believe that Uberizing eye care can become a compassionate business model for the future.
Thank you, sir. Thank you, everyone.
How much is the cost, Dr. Swati, of your setup, which carries? Mohammed goes to the mountain instead of the mountain comes to Mohammed here.
Sir, actually the C3FA is now around 4 lakh rupees. So, and the iCare tonometer, it's like one-time cost 4 lakh rupees, but we do use it in the OPD also. And the same is in, so we can recur the cost, we can renew the cost by the OPD, from the OPD. So we don't charge the patient for teleconsultation actually for now, because it's a pilot project. So we are doing it for free. But we were speculating that, okay, if we do it as a commercial basis, on a commercial basis, it will be a still cost effective way.
Dr. Muralidhar, if you have any questions.
Are you charging the patient now anything at all for this visit?
So as of now, no.
So we don't, the costing actually, whatever you have shown,
Yes, sir.
on
So
what basis has it been worked out? On what basis has it been worked out?
So normally we charge 400 rupees for the HFA.
Yeah.
And for the fundus photography, we do it as a package with OCT. So the total cost of OCT, HFA and fundus photography comes to 1,150. So if taking the petrol charges, the optometrist who is going there, or the trained technician who is going there, and the eye care tonometer, so we have just roughly come out as 1,500 rupees.
Is that the charge that is going to be taken from the patient in future when you say you regularize it and offer it as a service?
Yes, sir.
Brilliant concept. Swati?
Thank you, sir. Thank you so much.
Brilliant, brilliant.
Superb, Dr. Swati. Superb presentation and a very, very wonderful idea. I think this pandemic is forcing us to think of new ways of providing care to our patients. Thank you very much for your presentation.
Thank you, sir. Thank you so much.
So thank you, Dr. Swati, for the presentation.